Well, here we are back with Dr. Stein from Mount Vernon. Hi, Dr. Stein.
Hi, how are you?
Good. Dr. Stein, tell us a little bit about your dental practice in Mount Vernon. Mount Vernon is a very diverse area. You have many different ethnic groups living there, and it's quite a community, up there. In that, does it already fall Westchester County? Maybe not. I don't know.
Yes, it's part of Westchester County. Yes,
it is. So tell us a little bit on your practice, on where you come from, what is your philosophy in your practice, and what type of work are you doing in your practice? Because not every dentist does all dental work. There's many specialties, and not everybody involves in everything. So tell us what you do, tell us why you don't do certain things, and all that stuff. Will you?
Okay, sure. Yes, I've been in my present practice 12 years, but I've been a dentist for 20 years. I treat I'm basically general and cosmetic dentistry. I feel comfortable treating patients from children to adults. So basically all ages, and I do most treatment, whether it's basic restorative, cleanings, extractions. I used to work in a community health center, so I had a lot of experience doing extractions and dentures, but I do all, including a lot of cosmetic. I do lumineers, I do some orthodontics such as Invisalign or Clear Correct, and basically that's it. I don't do a lot of surgery, but basically, other than that, I do most work.
Okay, what about periodontal disease? Are you doing periodontal, deep scale cleaning, like a light periodontal, heavy periodontal? Are you doing either one of them or none?
Yes, I have two hygienists, and I do myself too. We start with the basic, first the basic cleaning and a checkup. We determine what the periodontal health is, and before doing surgery, we try to prevent a need for surgery. So the first thing we would do, if we see already development of gum problems or periodontal problems, then we start with deep scalings, which hopefully will prevent the need for surgery down the line. So, yes, we do that.
Okay, but if a surgery is needed, would you be doing it in your office or send the patient to a specialist?
We send a patient, to a specialist. We work with several periodontists, and we have a good referral relationship. So we, if necessary, if it reaches that stage, then we do refer to a periodontist.
Okay, all right. What about implants? Are you doing implants?
Implants, we do. I personally don't do the surgical part of the implant, but I have a doctor who's now coming into the office who's starting to work with us. Either that or we refer the surgical part out. I have, again, several surgeons that I work with, but the restorative phase, the build-up of the implant and the crowns, the bridges, that I do myself.
Okay. So you do implants, even placing the implants in your office. I mean, you have other doctors in your office doing that. Wonderful.
Yes.
All right.
Yes.
Well, good. Anything you think the patients out there should know about your practice? Something which, your patients like and love, and why they come back, or stuff like that?
Yeah, I mean, I really, I'm very gentle, and I try to spend time to listen to what the patient's needs, and to make sure that it's very important to me that the patients feel comfortable and at ease. People don't love going to the dentist. It's a place that can be fearful, and I've had many patients that have said to me that I really, that I know I can put them at ease. They feel very comfortable with me, and that's important. I've had a lot of work done myself, and I can relate to both as a patient and as a dentist to what the treatment is. And also, as you mentioned at the beginning, we have a diverse background. I do I do speak Spanish. I'm not totally, but I can speak Spanish and some Portuguese. So that makes people feel comfortable also because I don't have to rely on the translator. Most of the time I can manage and so that helps, as well to make people at ease.
Well, I'm sure it does. In fact, feeling comfortable with anything we do, and especially when it comes to medicine, and in medicine, frankly, especially when it comes to a dentist for some reason, feeling comfortable is definitely very important. And I have to admit, you have a very pleasing, feel comfortable personality. There's no doubt about it, Dr. Stein. So, didn't know you speak Spanish and Portuguese. Wonderful, absolutely great. Well, thanks a lot for letting us know. Bye, Dr. Stein.
Thank you. Okay.